We are ready. So I'd like to welcome the resource persons. Thank you for participating in this dialogue. It is important that we know where we are and where we are going in this time of multiple problems, especially in the mutation of COVID-19. So there's a news. I usually listen to international news roundup every evening, and I had the opportunity to listen very carefully the discussion of the new variant COVID-19D. So we need your advice, and it could spell the agony or the happiness of the Filipino people. This is something which I cannot decide alone because I am not a medical person, and I would need and welcome every advice that I can get from everybody who has the good grasp of the problem. So we begin today with a discussion of, before you have a report, Secretary Doke.
Mr. President, I would like to respectfully suggest that since you have opened up the matter of the variant, the Delta variant, the COVID-19 Delta variant, and we have the technical advisory group of experts, Dr. Edsel Salvania, Dr. Ana Onglin, and Dr. Isa Alejandria, joined in also by the head of the Philippine Genome Center, UP National Institutes of Health, Dr. Cynthia Saloma, and also Dr. Eva Cutionco de la Paz. These are all the members concurrently constituting the task force on COVID-19 variants. And now, the most alarming of the variants, as we all have been informed about, is the Delta variant. So, Mr. President, if I may just ask that we recognize Dr. Edsel Salvania to make the presentation on the Delta variant.
Dr. Salvania, kindly.
Thank you, Mr. President. I would like to acknowledge what you had mentioned, that the Delta variant is really very scary, and this is all the more reason why we really should police our borders po. Kasi it only takes one variant to get in, and then pwedeng mag-India-like surge po tayo kasi mataas po talaga yung number of people na kayang i-infect ng isang taong merong Delta variant. Kung yung dating virus po natin, yung original virus, dalawa lang po yung nai-infect, itong Delta variant up to 8 po. So it's up to 4 times more contagious than the original virus from Wuhan po. So this will really be a big disaster if we do not keep it out of the country po.
I am willing to listen, and you can go with your presentation. We are very happy to hear from you.
Thank you, Mr. President. Basically, this is a short talk about how we can keep the variants out, including the Delta variant po, and why our quarantine recommendations are going to protect our borders po. But basically, the rationale for our 10+4 strategy, as you are aware, the 10 days in facility quarantine upon arrival, and we test on the 7th day, and then we have 4 more days of home quarantine, is really designed to protect our country against the any COVID that is coming from abroad, because it takes about 14 days for COVID to show itself kung matagal na po. Kung hindi pa po siya nagpapakita on the 14th day, most likely wala pong talaga COVID yung taong yon. But if they get infected at the time of arrival, then if we keep them in the quarantine in the facility for 10 days, at least hindi nila mahahawahan yung mga kasama nila sa bahay. By the time we release them on the 10th day, they are almost no longer contagious. Now, ang problema po, if they try to test them on arrival, almost certainly, kung nahawa yung person na yon in transit, hindi pa po magte-test positive yon. So, arrival testing is not recommended by the technical advisory group, and this is why we test it on the 7th day, para kung nahawa man sila in transit, we have a good chance of picking it up. But more importantly, if we do not release them until the 10th day, even if our test did not work, the chances that that person will be able to spread into the community, even if that is a variant, is very, very low. And then dinagdag pa po natin yung 4 days na additional na home quarantine para yung 14 days po na original, as you had mentioned, will be followed. Maybe I will try to share my presentation kasi yung ano po, kasi hindi na ano.
We have the syllabus of your chart. We are following
okay,
you.
sige.
Andito.
Okay po, sir.
We will provide
Okay,
you
sige po,
the
sir.
syllabus.
Okay. Sige, sir. So, yung 10 plus 4 po, as I had mentioned, yung ano po kasi, on the slide that shows yung RT-PCR result, you can see naman po that day 1 to 3 of exposure, the RT-PCR will not be positive at all po. And then it is only on the 8th day where there is the highest chance of testing positive. But again, it is really the 10th day quarantine that lowers the risk. Kasi po, itong graph po na nakikita nyo, which is from the Centers for Disease Control, yung blue and purple po are what tells you what is the risk of transmitting to somebody if you only do 1 day of quarantine, 2 days of quarantine, 3 days of quarantine, all the way to 10 days of quarantine, assuming somebody is infected in transit. And you can see po, on the 10th day, halos zero na po yung risk na makakahawa ang isang tao. But if you release them on the 3rd or the 5th day, mataas pa po yung risk talaga, more than 20% to 40% the shorter you go. And then po, this is really worth it kasi there is really no risk of exposing the family as opposed to sending them home after doing arrival testing. And we know that arrival testing will miss up to 60% of the cases because the people might not test positive with RT-PCR yet kasi ano po talaga sila, false negative, masyado pa pong maaga. And of course, we need to keep out the Delta variant, which is very dangerous. So yung sa Taiwan po, ang nangyari, hindi pa to variant yung pinag-uusapan natin. Yung nangyari was they shortened the quarantine of their pilots from 5 days to 3 days and nagkaroon po talaga sila ng outbreak. And this is really bad because ngayon, alam naman natin, Taiwan did very, very well. And what ended up happening was that they were, they now have a surge. And this is because they shortened the quarantine.
Shortcuts.
And
That's the problem with shortcuts.
yes po, Mr. President. And then, yung variants of concern po, yung pinag-uusapan na po natin na Delta, yung po yung latest, 4 na po ang ating variants of concern, Alpha, Beta, Gamma, and Delta. Wala pa po tayong community transmission ng Gamma at Delta, and we really want to keep it that way. And that is why very important po yung stringent protocols natin. Yung Delta po, as I have mentioned, is 60% increased transmission over Alpha or yung UK variant, which was already 60% increased transmission over the original virus from Wuhan. So mabagsik po talaga to. If we thought Alpha was mabagsik, yung UK variant, mas mabagsik po itong Indian variant, yung Delta. And of course, there's also the finding that yung mga partially vaccinated, yung 1 dose pa lang, nahahawa pa rin po sila kasi mukhang itong Delta really needs 2 doses para maprotektahan po ng maayos. Yung 1 dose po is not very good at protecting against Delta. In the Philippines po, we've already had 17 cases of Delta, pero all incoming travelers po, and the protocols that you have approved have caught all of them po. So we have to continue and make sure that this is implemented nationwide because pwede po talaga tayong malusutan if we do not implement this strict protocol in all our borders because again, it only takes one. And so we have to be cautious po with our quarantine rules. Sabihin ko rin po kasi yung napag-usapan yung face shields, the Delta variant is also 40% more infectious outdoors, 60% more infectious indoors. So it would be nice po to have an extra layer of security na even if hindi naman required, the tag will still recommend to continue to use face shields even outdoors, especially with the threat of the Delta variant. And of course, we do consider the hardships of our OFWs who are fully vaccinated na matagal po talaga yung quarantine. But it is something that we have to study very carefully, especially with this new threat of the Delta variant. Thank you very much, Mr. President.
Salamat po, Dr. Salvania. Alam mo kasi, when I mentioned about the face shield, I was only shooting the breeze with the congressmen, members of Congress over there. I never said with finality that we will do away with the face shield. Now, I will agree with you, considering that this D variant is very aggressive and it can proliferate in so much short period of time. We may experience a second wave much more serious than the first. Ang problema dyan is I do not think that it will require the same vaccines that we are using now. The scientists, you people, you have to come up with something to fight COVID-19D. Wala pa tayo niyan. Second is we cannot afford it. Yung nangyari sa atin yung first wave, it has depleted really the resources of government. Now, another one would be disastrous for this country. That is why the stricter you are, the better. I'd like to tell you now, total, ikaw ang nauna na nagsalita, we will retain I will apologize to the Filipino people that this thing was being discussed openly, and many thought that we were ready to do away with the face masks. But with the kind of aggressive infection that poses a very grave danger to, it's a small inconvenience actually. I know that it is inconvenient really to be wearing the mask, adjusting it from time to time. But that is only a very small price to pay. Than rather gamble with doing away with it and courting disaster. Kasi ang transmission, it's accepted by all that it be transmitted to the eyes and to the nose. So I'm left with no recourse but really to adapt your recommendation. But I'd like to tell you that beforehand, while I said, reviewing the international news, nung narinig ko ito, I said, baka nagkamali talaga kami discussing about this in public because people thought that it was a done deal. No, it was not. It was just a casual chat. As of now, the face mask is on. Wala tayong magawa. The face shield. Importantly, the mask. Yun na lang ang pangkontra ko kasi it is to the national interest. I said that we must triple our effort because I said we do not know if it would require a new vaccine which has to be invented first. And second, we cannot afford a second wave because it might be far worse than the first. And then you will have a problem of our economy. And I said it would be a disaster for the country. Yes,
Sir, Mayor, clarification lang po. Kasi yung naging apela po ng IATF is para sa mandatory wearing of face shields in enclosed indoor spaces of hospitals, schools, workplaces, commercial establishments such as but not limited to food establishment, malls, public markets, public transport, and terminals and places of worship.
I'm doing away with that. That was just a suggestion, actually.
Oh.
It was put into writing, but it never came to my... wala sa table ko.
Opo, opo.
And I said, long before that, they were reduced in writing, maybe, yung mga narratives nila. I was really bent on restoring the mandatory use of the face shield.
Indoors
Kasi-
and outdoors po.
Kasi takot ako.
Opo. Indoors
So-
and outdoors po. Na para malinaw po.
Lahat. We go back
Lahat
to
po.
the normal before. So, balik talaga lahat.
Mr.
And
President,
itong quarantine must be strictly followed.
Thank you, Mayor,
No,
for the
no
clarification.
exception. No exception. Whether or not vaccinated somewhere else, it would depend on the medical persons to decide on what to do with them. Now, you can present the next speaker.
Mr. President, just to raise a clarificatory point, the IATF resolution on the wearing of the face shield will now be enforced as is, sir, yung dati natin na resolution, sir. So that means outdoor and indoor. Yung sa outdoor, yung as enumerated by Sec. Roque will stay, Mr. President. So basta malinaw lang po tayo kung ano yung dating IATF resolution on the mandatory wearing of the face shield stays, Mr. President.
Well, I'm constrained really to go back to the old practice because of this danger posed by the D variant. Kung wala lang sana yan, especially I said with the narratives that goes with it in the international news and even dito sa locally, it's scary. So, I cannot afford to place the nation, the national interest of the republic by just, sometimes adopting this and being lenient to this. I said, I know that it is a very tedious, if you may, but it is really to prevent a disaster of our nation. So, Secretary Duque, who's your next resource person?
Yes, Mr. President, if the issue on the wearing of the face shield has been resolved, although, of course, we have they prepared a presentation on why it is important to continue with the policy of the face shield wearing. Would you like to listen to that presentation, Mr. President?
Yes, of course.
Okay, Mr. President,
regard,
may we have Dr. Anna Ong Lim and the other members of the TAG to make the presentation?
It will further our education somehow.
Yes, Mr. President. Thank you so much, Mr. President.
Thank you po, Mr. President, and good evening,
Good evening,
to the
ma'am.
rest of the attendees. This is Dr. Anna Ong Lim. Are you seeing my screen?
I see you.
Kita na po yung screen.
Hmm.
May I request the Secretariat to please present it?
Yeah, the PowerPoint is there.
Okay. I think we need to go back a couple of slides. So on behalf po of the Technical Advisory Group composed of myself, Dr. Salvania, and Dr. Alejandria, I've been tasked to make a short presentation about the face shields. And just to start off, meron po tayong several na policies and resolutions na kailangan pong balikan. So last December 2020, the Interagency Task Force for the Management of Infectious Diseases under the Resolution number 88 mandated the wearing of face shields whenever people would go out of their residences. And this is because it was known to be effective in reducing the risk of transmission between persons. It was available and it was also low cost as an intervention. And following these issuances, the Department of Health, the Department of Trade and Industry, as well as DOLE, DOTR, DILG, DPWH, the Philippine Sports Commissions, and the Games and Amusements Board issued a JMC 2021-0001 to provide specific provisions for implementing measures in various settings like communities, workplaces, business establishments, film and audiovisual activities, as well as physical activities and sports, and inactive and public transport. Next slide, please. So there are actually several findings from studies conducted by different teams. Kasama na po yung grupo ni Drs. Chu et al. And this is published internationally. And they indicated that meron pong evidence that eye protection, such as face shields, actually are able to reduce 78% infection, such as through the ocular route, which occurs either by droplet or aerosol or self-inoculation. Dahil po pag nahahawakan po natin yung mata natin, syempre pwede mo doon pumasok yung mikrobyo. Likewise, they also demonstrated that the use of masks reduced infection by 85%, and physical distancing also reduced infection by 82%, with every additional meter of separation producing even more protection, and data was able to support this distancing up to 3 meters. So sabi po nung authors, syempre wala pong nag-iisang intervention na pwede pong magbigay ng buong proteksyon. But of course, pag pinagsasama-sama po natin to, nakakatulong. And this is what we advise in our minimum public health standards as necessary for mitigation of transmission of COVID-19. Next, please. Meron pa rin pong study na conducted po in India, and this is actually a real-life demonstration where the use of face shields could have reduced exposure of field workers who were actually doing surveillance dun po sa kanilang mga communities. And this led to 62 healthcare workers who did not wear face shields, visiting almost 6,000 homes, no? Na 12 po doon ay na-infect nung wala pa pong face shield na ginagamit. Pero nung minandate na pong gumamit ng face shield itong mga community-based teams, 50 of the healthcare workers who were required to wear face shields, none of them were infected, as they visited almost 20,000 homes where almost 3,000 individuals tested positive for SARS-CoV-2. So dito po sa study na to, nakikita po natin yung real-life effect nun pong paggamit ng face shield. Nung wala pa pong face shield, may mga nai-infect na healthcare workers. Nung pong gumamit na sila ng face shield, kahit pareho po yung ginagawa nila at nagbabahay-bahay at nag-i-interview, wala pong nahawa sa kanila. So with that, no, dahil po sa proteksyon na maaring ibigay ng face shield at sa patuloy na pagdami ng COVID-19 variants na napatunayan naman nating mas nakakahawa, inirekomenda na ipagpatuloy ang pagsuot ng face shield sa labas ng bahay. So this is recommendatory, it's strongly recommended. Pero we submit na dapat po sana pag nasa loob po or indoors tulad ng mga establishments or workplaces ay dapat maging mandatory ang pagsuot ng face shield dahil nga po yung ventilation ay hindi po natin makontrol ng maayos. Habang mataas pa po ang bilang ng mga kaso ng COVID sa ating bansa at habang marami pa rin po ang hindi nababakunahan, we strongly recommend na mas maigi po yung magdoble ingat para maiwasan ang tuluyang pagdami ng mga kaso. Maraming salamat po.
Thank you, Doctora. Apparently, from up to now, since we started, there seems to be really, well, it weighs heavily in favor of just retaining the original protocols, social distancing, the mask and the face shield. And kung gusto mo talaga masigurado, in face of the danger of COVID-5, then we might add another layer, yung eyeglass, plus the face shield. Pa naman siguro kung hindi ka lang reckless talaga, you do not use your hands. Ako pa naman sanay ako dito, yung I play with my, nakita man ninyo minsan ang ano ko nakagano na, I don't know, but it's a bad habit. Kaya tinatalian ko na itong isang kamay ko para hindi ko na talaga mahatak. I accept your recommendation. This is the twice over na. So, I'd like to thank the panel, and I'd like to thank also that you recommended the safest way for the Filipinos. Salamat po. I salute you. There's another one kay Secretary Briones, yung face-to-face, ma'am, we might differ in our opinions about the matter, but for as long as there is really no vaccination, all. Total naman, pag nabakunahan na, and it hinges really on how industrious Secretary Galvez is buying all. Ito nang sabihin ko sa inyo. In the last meeting, Carlos Dominguez III, the Secretary of Finance, said clearly that we have the money already reserved for the vaccines, and it's there. So we can buy as many vaccines as required. Maski na sumubra, mas mabuti ang sumubra kaysa makulang. And we pray that Secretary Galvez will be guided by the Lord so that he can really go where the vaccines are. Ang sa ma'am, dito sa face-to-face, I think I am not inclined to agree with you. I'm sorry, but mahirap. I cannot gamble on the health of the children. I hope you'd understand.
Oh yes, Mr. President, there are two bases for the DepEd position on the matter of opening of classes and face-to-face. One, of course, which we consider very heavily, is the impact on the economy, because education and the economy are closely linked. The second, of course, is the legal basis for the opening of classes and all other activities. We have a law which was passed last year, Mr. President, wherein it is the President, upon the recommendation of the Secretary of Education, who will decide on the matter of opening of classes and therefore also on other activities. That part we are familiar with. We have all the data. But there is another aspect, and we recognize it, especially after this briefing and the meetings of the IATF, the matter of the health of our children and of our teachers, Mr. President. We're talking about 27 million children and 847,000 teachers. That is where, Mr. President, agreed with you, even as the public strongly excoriated and criticized and cursed the Department of Education. But we said that you are protected by law and you cannot play around with the UK variant. And this time again, always we try to keep ourselves prepared just in case if things get better, if the numbers are flattened, and if there is more hope, then if you say open the schools, we will open the schools. But considering the latest report a few minutes ago and last week, we would not in any way oppose vision of law. And secondly, the matter of health and the dangers that are posed to our 27 million children is not within our line of expertise. We cannot match the professional knowledge of the health people. And this is why we always say that we rely on the Department of Health and the wisdom of the President. So there is really no problem, Mr. President. I came hoping for support for our learning continuity program na maski 100 pilot. We identified actually, Mr. President, 1,900 schools which might qualify. We kept on bringing it down. Now we said maski 100. But listening to the briefing and listening to your decision, we don't have any reservations because we all know the effect, and especially the idea, Mr. President, of having also our children vaccinated, because we are told that children are now more prone and perhaps are vulnerable, and we would not want to risk 27 million children and our teachers. And besides, we are part of the executive, and what the executive decides, we support and we cooperate, especially on a professional matter as this, Mr. President. So we are withdrawing our requests in the light of your decision, and we accept fully your decision, which is a very well-informed decision, if I may say so.
Thank you.
Thank you, Mr. President.
Thank you, Secretary Bronis. I'd like to just, I respect, I'm a lawyer, I respect the judiciary. And I can assure them that we will follow the orders. But at this time of a national emergency, I would just like to inform the courts that I will not follow them. I will insist on what is necessary to protect the people. It is not what the legal book says about, in the matter of stopping the protocols, the requirements by law. Si Gwen naman, she went to see me the other week, and I assured her that we are fair, and we would like to, I see the wisdom in her view, but I said the overwhelming notion among us in government and the medical doctors simply do not agree with her. So I leave the fate of Governor Garcia's DILG. There are some mechanics that can be put into action to compel obedience. Not because we want to be mas marunong, but remember I said that all our decisions are based on what the medical people say, period. Secretary Roque?
Well, with all due respect to Secretary Anyo po, I read the link that Secretary Anyo said, and it is not Governor Gwen Garcia who filed the TRO. It is lawyer Benjamin Cabrido Jr. Just for accuracy po. But I assure you that we've also explained as much as we could to the good governor the scope of presidential powers on police power in protecting the health of the people now remains paramount. Although it's an interesting legal question, but I think in the end, without second-guessing the court, it is important to highlight that one of the most important power, executive power, is the power to protect the public from a health risk. Thank you po.
So the courts are put on notice that what we have here is a national emergency. That's why we came up with a proclamation declaring this pandemic is of a national interest. So, yung mga korte, hindi naman sa'yo, wag na lang ninyo ipalabas. Kasi magkakaroon tayo ng impasse. And I do not want to lock horns with the judiciary. I said, nirerespeto ko. But there are times that, may panahon na there is always a time that the courts can function normally and maybe grant injunctions and all. But this time, I said they are put to notice that hindi ako magpipigil. I will not obey the courts in the matter now of management the pandemic. I do not want anybody from any government agency or department messing up with a situation which is, I said, is being managed because it is very dangerous to the country. Hindi ako maniwala sa I advise the court. So, wag na lang niyo ilabas. Pag may ilabas na dyan, talagang there will be a raucous. And I'll be forced, I will just say that I am here to protect the people. And for as long as I am guided by reason, that's what is factual, backed up by studies, then I will follow what the medical science would tell me. That is my answer.
Thank you very much, Mr. President, for the strong words of reassurance, and I am sure this will assuage the fears of our implementing units in the province of Cebu, because they have really raised the matter before the IATF for the last several days, that they are really fearful of the consequences that they might be hailed to court or filed cases against if they do not follow the provincial ordinance and the executive order that was issued by Governor Gwen.
Ganito yan eh.
Yes, sir. Thank you.
Sinabi niya sa akin that there is an ordinance. An ordinance of a local government unit cannot be higher than a national policy, which is the policies that we are dishing out are not mere policies. They are guided by the proclamation, and they are the laws of the yun yung batas. Because of the emergency, ganito itong batas natin. This is how we do it. So, not all cases can really be the subject of an injunction or a TRO for that matter. I'm sorry, but hindi lahat na bagay that the courts will interfere. Any court, for that matter, I'm putting notice on hindi ako susunod. Now, if you want to, well, I'm sorry. You know the stakes. Kayo. Basta ito ang position ko. Well, what was the next? Secretary Duque, you seem to be the moderator.
Yes, Mr. President, thank you very much. Now is my turn to present the usual COVID-19 situationer for the country. If you will allow me to make the presentation, Mr. President.
Okay, go ahead.
Thank you. Magandang gabi po, Mr. President, at sa akin po mga kapwa kalihim at sa ating pong Senator Christopher Lawrence Bongo, Chair of the Senate Committee on Health and Demography. At sa ngalan po ng Department of Health, ako po ay magbabahagi sa inyo ng isang maikling ulat ukol sa ating COVID-19 situation. Can we have the second slide, please? So ito po yung akin sinasabi na bagong kaso natin sa taas, may total of 1,364,239. Today, we have reported 5,249 new cases. At of these, total cases, 55,847 are active cases. And the recoveries number to 1.28 million thereabouts, with again new 7,053 recoveries included in the report, whereas the case fatality rate is at 1.74%. At ito naman po sa atin mga active cases, 96.79% are mostly asymptomatic and mild to moderate, while the rest, 1,790, or equivalent to 3.21%, comprises the severe and the critical COVID cases. Next slide. Nitong nakaraang linggo, Mr. President, bahagyang bumaba sa mahigit na 6,200 ang ating average daily reported cases mula sa mahigit na 6,600 noong June 7 to June 13. At makikita po dito sa slide na ito na patuloy na nagpa-plateau ang paggalaw ng ating mga kaso. Yung black line po, nakikita natin halos diretso na po siya. Next slide. Kung titignan ang mga kaso per island group, patuloy ngunit mabagal na ang pagbaba ng mga kaso sa NCR. Ang representative epidemic curve is the blue line for NCR. And yung plus areas, green line naman. So dito ay naging mabagal po ang pagbaba, pero bumababa ang mahalaga po rito. At para naman sa rest of Luzon, yung pulang linya, nagpapakita ito ngayon ng mga senyales ng pagbaba mula sa pagplateau nitong mga nakaraang linggo. Habang kasalukuyang nagpapakita ang Visayas, ito naman po yung aqua blue ng mga senyales ng pagplateau mula sa mabilis na pagtaas noong Mayo hanggang Hunyo. At huli, tumataas ang mga kaso sa Mindanao. Yung pong orange line sa baba, nakita po natin ay tumaas na po siya. Ganun din, susunod na tumataas ang Visayas. So, ito po ay atin pong binibigyan paalala ang atin pong mga local chief executives sa mga naturang lugar na kanila pong dapat i-intensify o paigtingin ang kanila pong PDITR strategy and also improving their vaccination coverage, supply permitting. Next slide. Kung titignan naman ang average daily attack rate at 2-week growth rate ng iba't ibang rehiyon, makikita na mga rehiyon sa Mindanao ang karamihan sa atin mga high-risk groups kung saan nadagdag dito ang regions 11 and 12 nito pong nakaraan linggo. At patuloy na tumataas ang average daily attack rate ng Caraga. Yan po ang regions 11 and 12. Ngunit bumaba naman ang kanilang TWGR. At nangangahulugan ito na patuloy ngunit bumabagal ang pagtaas ng kaso sa mga naturang rehiyon. Pero special attention to Region 6 kasi dito patuloy na tumataas ang kanilang panukatan na ADAR and TWGR ng Region 6. Makikita natin from May 23 to June 5 ang Region 6, 6.28 ang kanyang average new cases per day, tumaas po sa 8.83 per 100,000 population. At ganoon din po ang kanyang 2-week growth rate from May 23 to June 5 from 36%, tumaas po ng 41%. So dito po ay binabantayan din natin ang Region 6 at ang mga lalawigan at syudad na bumubuo dito. Sa kabilang banda naman, ang nananatiling bumababa ang ADAR at stable ang TWGR ng National Capital Region, habang malaki ang naging improvement naman ng Region 2 na high risk nung nakaraan linggo. So may improvement, makita po natin sa baba, ang Region 2 ay from 14% ang kanyang 2-week growth rate, bumagsak po ito sa negative 21%, which is a very good indication of the effectiveness of their interventions. At ganoon din po, ang kanilang ADAR bumaba from 10.95 cases per day per 100,000 population, naging 8.61. Although as a high risk pa rin po ang kanyang classification. So, ayon po sa atin mga regional epidemiology and surveillance units, ang kadalasan dahilan ng pagtaas ng mga kaso ay ang pagsagawa ng mga malaking pagtitipon na maaaring maging super spreader events, no? So we would like to remind that we do everything to make sure that there will be very, very minimal to zero super spreader events, no, in the various cities, municipalities, and provinces. Dahilan din daw ang kakulangan sa ibang lugar ng TTMFs kung kaya't ang mga close contact ay naka-home quarantine. Pati na ang pagluluwag sa border control protocols ay isa rin sa mga dahilan kung bakit nagkakaroon po ng pagsipa ng mga kaso. Ang iba pang nakikitang dahilan, ang diskriminasyon o manong nakukuha ng mga COVID-19 positive cases, kaya naman kanila pong dinidelay ang pagkonsulta sa mga doktor. Kami po ay patuloy na nagpapaalala na kapag tingin natin ay na-expose po tayo sa isang positibo na kaso o di kaya ay nakaranas ng sintomas na tulad ng COVID-19, agad na po tayong magpakonsulta. Or mag-isolate na po tayo kaagad. Huwag na po natin antayin na tayo ay makapanghawa pa at maging mapagpatuloy ang kadena ng hawaan. Hindi po tama ito. Next slide. Improvements naman po in the national healthcare utilization rate. Dito po nananatiling mas mababa ang ating national healthcare utilization rate kumpara noong tayo ay nagpatupad ng ECQ and MECQ noong Abril. Ngunit bahagya pa rin itong mas mataas kumpara sa ating lagay noong Marso bago ang surge. At dahil ito ay sa naranasan high risk H-score at ICU utilization rate sa iba't ibang rehiyon, lalo na po sa Mindanao at Visayas. Pero dito makikita po natin, Mr. President, overall H-score, bumagsak po tayo by 7 points from 54 down to 47%. Samantalang ang mga iba pang panukatan, ang isolation beds, COVID ward beds, ICU beds, and mechanical ventilators, lahat po ay nagrehistro ng bawas from negative 5 percentage points all the way to negative 12 percentage points for mechanical ventilators. Next slide, please. Ang H-score naman, ang healthcare utilization rate sa Region 6, ito naman po ang litrato. Overall, H-score ay from 68%, nagkaroon po ng konting improvement, naging 65% for a 3 points lower utilization rate. At ganoon din po ang ISO beds, COVID ward beds, ICU beds, and mechanical ventilators. Makikita po natin ang COVID ward beds ay tumaas po ng 2 puntos from 68% to 70%. At ang ICU beds naman ay nananatili sa high risk at 84% utilization rate compared to June 13 and the current utilization rate of 84%. So hindi po gumalaw yan at sana bumaba pa rin po ito. At ang mechanical ventilators ganun din po. Ako po ay nananawagan sa atin pong mga hospital chiefs na kailangan po dagdagan nila ang ICU bed capacity. Kung pwede lang i-increase, dagdagan ang ICU bed capacity by converting the isolation beds. Kasi yan, makikita natin ang isolation beds, medyo malaki pa po reserve capacity. 60% lang po ang kanyang utilization rate. Ano po, bumaba pa nga po ito. So, magandang i-convert ang isolation beds to ICU beds para lumawig ang kanya pong kapasidad. Ang ating H-score naman sa Region 12, sunod na slide please, Region 12, ay tulad ng Region 6 na sasabayan ng pagdami ng allocated beds for COVID-19 ng Region 12 ang pag-akyat ng mga kaso sa riyon. At bagamat umakyat, bahagya lamang ang itinaas ng H-score sa riyon mula nung nakaraang linggo at patuloy at mahigpit natin minomonitor ang ICU utilization sa riyon na ngayon ay nasa high risk level. So kung titingnan po natin, although overall ang overall H-curve bahagyang tumaas, pero yung ating COVID, yung ICU beds natin ay tumaas din ito na asa high risk na rin po at 81% or an increase of 3 percentage points. No? So next slide, doon naman sa dako ng Region 11, ang healthcare utilization rate. Dito po ang kanyang June 20 healthcare utilization rate as a 63%. Hindi po gumalaw. So pareho pa rin compared to June 13 at 63%. Ang isolation beds ay bumaba ng 1 percentage point. Ang COVID-19 ward bed tumaas po ng 4 na puntos. At ang ICU beds, ito po tumaas naman ng 8 points. At malaki po ang tinaas ng ICU bed utilization sa Region 11. Ganun din naman, ang maigi lang, Mr. President, ang mechanical ventilators natin ay bumababa naman by 10 percentage points. Kanya, ibig sabihin po nito ay although hindi ganun kataas ang ating mechanical ventilator utilization rate, pero bantayan natin ang ICU beds. Ano po? So, ganun din po ang ating abiso sa ating po mga hospital chiefs. Unang-una, kinakailangan itaas po ang COVID bed allocation ng mga pribadong hospital from 20 to 30%. At ang mga pampublikong ospital naman po dapat itaas kaagaran from 30% to 50% ang COVID bed allocation. And pangatlo po ay ang conversion ng ating po mga isolation beds, 55% nga lang po as of June 20, to ICU beds para mas mabawasan pa natin ang healthcare utilization rate ng ICU beds at bumaba po ito hanggang sa maaari sa moderate risk classification, which is at 60 to 69%.
Thank you.
Next slide, please. Ang H-score naman sa Region 10, ito naman po ay ang overall utilization rate ng kanyang hospital capacity ay bumaba po ng 4 points. Ang isolation beds all the way ay hindi nagbago. Ang COVID-19 ward beds ay bumagsak po ng 14 percentage points. Ang ICU beds naman ay tumaas. Medyo nakakatakot po ito, Mr. President, kasi ang laki po ng kanyang itinaas by 24 points. At muli, yung aking sinabi kanina ay sundin po natin. Tumalima po kayo sa abiso ng Department of Health. Sa mechanical ventilators po ay bahagya naman, malaki din naman ang ibinagsak. Maigi lang, from 47% to 34% or 13 percentage points. Next slide, ito naman po yung ating confirmed COVID-19 deaths by week. Ang total deaths po natin as of today is 23,621. Patuloy naman ang mabagal, ngunit bumababa ng ating mga naitatalang mga pumanaw at sa kasalukuyan nasa 56 deaths per day po tayo ngayong Hunyo at nakapagtala na tayo ng 1,150 deaths sa loob ng 20 araw ng buwan na ito. So makikita po natin doon sa table na yan ay nasa 56 daily average po tayo, 56. At sana ito ay hindi na po tataas. Noong May, napakataas po ng ating daily reported deaths, no? At 106 per day. And in fact, noong April, kasagsagan natin, umabot tayo ng 121 deaths per day. Ano po? At so ngayon ay nakikita natin maliwanag at bumababa. Sa kabuuan po, una, patuloy na nagpaplato ang ating mga kaso habang ang Mindanao ang ating kasalukuyang highest contributor sa ating mga naitatalang kaso kada araw. Ikalawa, patuloy naman bumababa ang ating naitatalang deaths. Gayunpaman, mas mataas pa rin ang naitala natin deaths ngayong buwan kumpara noong Enero. At ikatlo naman, habang maganda na nasasabayan ng ating pag-allocate ng COVID-19 dedicated beds ang pagtaas ng mga kaso sa Visayas at Mindanao, kinakailangan maging maagap pa ang ibang rehiyon, lalo na ang mga rehiyon na nagkaroon ng malaking pagtaas sa ICU utilization rate. At panghuli na po, kinakailangan natin maging listo at alerto sa pag-aksyon sa dumadaming mga nagkakasakit at na-admit sa mga ospital habang pinanatili natin ang ating mga nasimulan kung gusto natin masugpo ang nararanasang surge sa Visayas at Mindanao. Pinaalalahanan namin ang mga riyon na i-monitor hindi lamang ang naitatalang kaso kada araw, ngunit pati na rin po ang long-term trends na makatutulong sa higit na pagsisiyasat upang maihatid ang pinakaangkop na response strategies. So ito na lang po, Mr. President, ang pinakahuling bahagi ng aking ulat at handa po akong sumagot sa inyo po mga katanungan. Maraming salamat po.
Thank you, Secretary Doke. May tanong lang ako sa iyo. How many local governments have received the vaccines? Dito, ilang siyudad o probinsya na nabigyan ng mga bakuna?
Meron po tayong allocation plan, Mr. President, for every region and for every province, cities, and municipalities. But because of the surge in the cases, nag-decision po ang ating pong IATF at sa pamunuan po ni Secretary Galvez na dagdagan ang mga surge areas, Mr. President. So, meron pong report malamang ang ating pong vaccine czar, si Secretary Galvez, patungkol po sa allocation.
Sige, kasi I'm just wondering, there are in Mindanao, sabi mo, it has surpassed the number of cases doon sa Luzon. Sa dito sa Mindanao, ilan na ang nabigyan ng bakuna?
The detailed information, Mr. President, is with Secretary Galvez.
So I hope that it would move faster. Kasi ang ano kasi dito is, well, as long as we have the supply in steady manner, there's no reason why we should also dilly-dally in the distribution of the vaccines in the provinces. Before I give you the kay Dr. Domingo, mauna muna tayo dito kay Secretary Galvez so that you would know how much ammunitions we have against the fight of COVID.
Mr. President, fellow cabinet members, Senator Bongo, magandang umaga po sa ating mga medical experts present today. Sa ngayon po, magkakaroon po tayo ng briefing on the updates on our vaccination program. Next slide, please. Ang number one po is the Philippine Vaccination Center have reported that we have reached 8 million mark last Friday, June 18. We have already received 14,205,870 vaccines with 5,876,820 doses for the month of June. We are expecting to receive 4 million more before the end of the June. We will be receiving the COVAX that I will present later. And then the good news is that the Philippine negotiating team, headed by USEC Mark Hoben and also the DOF team, was able to sign and concluded the Pfizer. Secretary Duque and I signed the supply agreement last Saturday, which consists of 40 million doses. This is the biggest deal, Mr. President, and we are really thanking Pfizer for really fulfilling their commitment. That even though the negotiation was long, the delivery is the same time of delivery. And the volume from originally we are negotiating only 15, they increased it to 40. And Mr. President, we will be surprised later on if we will be given the price will be at the public domain. Makita po natin na napakaganda po ng binigay po ng Pfizer sa atin. One of the best deal that we ever had. And we really thank si Ambassador Babes Romualdez, ang ating American Embassy, and also the American government for really providing us this big volume and also on time. Ito po, maganda po ito dahil kasi baka magamit po natin sa children kasi majority of this volume will be given during the third and fourth quarter. Lalo na po sa fourth quarter pagka nag-open up na po tayo ng vaccination po natin. At nakita po natin ng Pfizer na sa ating EUA, pwede na po ang 12 and above. And then dumating po kahapon yung Israeli expert to share their latest experience on vaccination program. Kanina po, nagsimula na po kami. At maganda po yung mga experiences natin, mga protocols, and also kung paano nila pinapangalagaan ang kanilang mga vaccine. Tomorrow, magkakaroon po kami ng extensive discussion on logistics management, on how we will preserve our vaccine so that we will not have wastage, and how we can distribute it the soonest possible time as you directed to us, that it will be delivered on time to the provinces. Kasi po talaga yung ibang mga vaccine natin, nahihirapan po tayong i-dispose doon po sa rural areas dahil kasi po very sensitive. And with their experience on handling cold storage, yung isa pong specialist po doon, siya po yung parang kasama po sa mga cold storage facility na binigyan po ng authority ng Israel. And then also, nakakatuwa po yung the LGUs are scaling up their daily capacities. Siguro po si Senator Bongo talagang miya't-miya po, maraming po tumatawag kasi nauubusan na po sila ng vaccine kasi tumataas po ang mga capacity ng ating mga LGUs, particularly po sa mga rural areas at saka sa mga highly urbanized city. Even ng Cagayan de Oro, talagang tumatawag din po dahil kasi mabilis po ang consumption nila from 5,000 to 8,000. Yung Ormoc, ganun din po. Yung Negros, yung Iloilo, tumatawag po dahil kasi kayang-kaya nila po nila yung 5,000 to 8,000 a day. At nakakatuwa nga po dahil kasi yung ibang mga LGU talaga, they're increasing their capacity and they are mobilizing all the different stakeholders. Mamaya po pakita po natin na talagang yung ibang mga sektor ay kanilang minamobilize at in-integrate so that they have an increased capacity in the vaccination. And then, kanginang umaga po, diniscuss po din namin ng T3, meron po tayong tinatawag na Boston Consulting Group na nagbibigay po ng mga information globally kung ano po nangyayari worldwide. Kasama po yung pag-increase ng kanilang vigilance on the Delta variant, which we will provide some slide. And then, yun po ang ginagawa rin po namin dahil kasi ang business sector at saka yung LGU ay pinagbabantay na po natin din sa Delta variant dahil nakita po natin na napakataas ng kanyang transmissibility at saka meron talagang yung severity, meron pong talagang medyo dangerous po siya. So yun po ang ginagawa po natin para at least yung lahat ng stakeholder, there will be a continued vigilance. And then yung tinatawag natin yung stringent control and also yung tinatawag na preparation sa ating pandemic response on a large scale so that we can have yung yung tinatawag natin yung kung ma-anticipate po natin na alam po natin na yung kung ano nangyayari sa India and we have to anticipate everything in large scale, yung lahat ng pandemic response po natin. And then pinakita rin po doon sa presentation na in some extent pagka naka-double dose na po tayo, fully vaccinated, ay kaya pong ano po yung variant. Ibig sabihin, meron po tayong protection even sa mga variant po. Mamaya po iyan po natin. And then yung nga po sinasabi ng ating mga expert na kailangan po natin talagang walang compromise sa strong border control. Sinabi nga po doon ng presentation ni Father Nick Austriaco at saka ng ating Boston Consulting Group na yung ginagawa po ng Cebu ay very, very dangerous as compared sa stringent policy na ginagawa po abroad. Even I believe yung Israel na fully vaccinated na, talagang 14 days ang quarantine po nila sa mga travel border control po nila. So ganun po karamihan ang policy ng mga ibang mga countries na hindi po mababa ng 14 days. Yung iba pa nga po, 21 days po. Next slide. So ito po yung ating magandang mga numero na sa ngayon po, tumaas, sinabi nga po ni Secretary Duque, na tumaas po yung ating tinatawag na working average, yung weekly average po natin. Dati po, nung last week, nireport ko po sa inyo, 900,000 lang po ang ating na kumpleto sa weekly po natin dito po sa right hand side. Sa ngayon po nakapagtala po tayo ng from June 15 to June 20 ng 1.4 million jobs per week. And then June 15 na breach po natin yung ating record na nakapagtala po tayo ng 322,929 jobs. Ang kagandahan po dito, Mr. President, malapit na po natin matapos yung healthcare worker ng first job. Nakaka-96% na po tayo. Yung ating pong talaan sa ating master list ay 1.6 million. Ang ating pong nagkaroon po ng first job is already 1.5 million. So konti na lang po, bali 4% na lang po ang kailangan po natin. At saka ang kagandahan din po doon, 1,067,630 na po ang fully vaccinated na ating healthcare workers. At tumataas din po ang numero ng mga senior citizens natin at saka yung ating may comorbidities na naka-reach na po tayo ng 2 million each. So sa ating A2, meron na po tayong 2,01,758 at sa A3, meron na po tayong 2,088,000 na vaccinated or more or less 41%. Nagsimula na rin po tayo sa A4 at yung iba po nagsisimula na po sa mga tinatawag nating mga indigent population, yung mga poor communities. So meron na po tayong nasimulan na 67,185. Ito po talaga yung nasa slum areas. Talagang kinukuha po natin talaga sila para at least magkaroon po ng tinatawag nating vaccination. Kasi sila po ang marami sa hesitant na talagang magpa-vaccinate. At sila po ang pinaka-vulnerable. Kaya po yung guidance niyo po na bakunahan natin ng mga mahihirap, ang ginagamit po natin pang babakuna po, mga Pfizer at saka yung po talaga. So doon po natin dinideploy ang ating mga bakuna na galing sa COVAX. So sa ngayon po, nadagdagan po ang ating vaccination site. Kung makita po natin vaccination site, nung huling report ko po is 3,900 lang po ang vaccination site. Ngayon is 4,055. So tumataas po ang ating mga vaccination site at ang target po natin, Mr. President, is magkaroon tayo ng more or less 5,000 vaccination site. Hindi pa po tumutulong dito ang mga mass vaccination site ng ating private sector. Pagka once na dumating na po ang kanilang mga delivery na more or less 1.17 at saka yung dumating po ang Moderna next month ay talagang tataas po. Ang Soler, kaya niya po ang 12,000 kada araw. Yung ibang mga vaccination site, pumapatak po ng mga 3,000 a day. So yun po ang i-establish po ng mga private sector at yung mga malls, yung mga hotels at saka yung mga parking lots ay gagamitin po na mass vaccination site. Next slide please. So sa ngayon po, pangalawa pa rin tayo sa ASEAN, 13 pa rin po sa all Asian countries at 31st pa rin po sa more or less 200 countries globally. Next slide, please. So ito po ang mga darating pa pong bakuna po sa atin. Nagpapasalamat po tayo sa China dahil kasi ang China po ang very faithful po ang kanilang delivery. So this coming June, meron po tayong 1.5 million at ang inyong pong directive is majority po nito i-deploy po natin sa mga nag-research at saka yung mga provinces na hindi pa po nakakakuha ng kanilang mga vaccine. So yun po ang ating commitment na talagang sana po konting pasensya lang po sa ating mga probinsya dahil kasi pagka pinaghati-hati po ang natin lahat ng mga probinsya, talagang ang majority po magkakaroon lang po ng 15,000 to 20,000 po ang pinakamalaki Na-compute na po namin yun, Mr. President, na if we have 81 provinces kasama po ang NCR, talagang ang pinakamalaki pong makukuha ng isang probinsya is only 15 to 20,000. Yun lang po talaga. Kaya po mangyayari, nakikita natin, madidilyot po ang ating mga vaccine. Kaya nga po, na maganda rin po, Mr. President, yung mga highly urbanized cities at saka yung mga nagsisearch po ngayon, yun ang babatuhan po natin ng malalaking volumes po ng mga vaccine. So sa ngayon po, darating po ang June 24, ang Sinovac, and then ang Moderna, June 27. Hopefully, yung AstraZeneca po ng COVAX, dumating din po ng June. At saka po yung US donation. May commitment po ang US na magbibigay po sila ng kanilang tulong sa atin. At ang pinangako po nila is before the end of June. And then sa July, we are expecting another 4.5 million of Sinovac. Pero ang sabi po ng Sinovac, baka dagdagan po nila ng 1 billion pa yan para maging 5.5 million o 6 million. Dahil ang pangako po nila, yung 20.5 million po na Sinovac na ating kinuha sa Asian Development Bank, instead na i-deliver po nila ang whole stretch ng hanggang November, i-deliver na po nila yung 20 million hanggang September. So ibig po sabihin, mas marami po ang may bibigay ngayong month ng June, July, August at saka September. Tatapusin po nila yung delivery by September, yung 20 million. So meaning, minimum na 5 million to 6 million po every month ang bibigay po nila para po sa ating mga, tawag natin sa mga probinsya po natin. Pwede po yan i-deploy sa mga probinsya dahil 2 to 8 lang po ang kanyang requirement. And then ang COVAX, 4 million. And then Moderna po, aakyat po ng another 1 million. Yung AstraZeneca po, ito po sa private sector po to, tsaka sa LGU. And hopefully yung Sputnik po ay makapag-deliver na po ng at least 1 million. Next slide, please. Next slide. Ito po yung po natin na yung nagkaroon po tayo ng signing ng 40 million. Napakalaki po ng impact po nito dahil kasi talagang ang po nito, ito yung biggest po natin. And then tutulong po ang US na at least makapag-deliver po na mas maaga. By August po, makapag-deliver na po. Next slide, please.
Ang ganda ka dyan
Sir?
Serious masyado.
Sir, gabi,
Yung slide.
10 o'clock po ng
Yung
gabi.
nagpipirma ka.
10 o'clock po ng gabi po yun, sir. Kasi po ako po ang nasa akin na po bola, nakapirma na po si Secretary Duque. Ako na po ang hulang pumirma.
Well, the effort is as good as any.
Opo, mabilis pong pumirma si Sec Duque. Kaya nung nahuli po akong pumirma. Next slide, please. So ito po yung pagdating po ng Israel delegates. At ito rin po yung sa kanan, nagsimula na po tayo ng discussion. Kasama po natin si Sec Duque, Sec Del, Sec Vince Dizon, at saka po yung member ng NBOC. Magagaling po yung lalo na po yung yung babae, sir, magaling sir yun. Siya po ang strategic planner. At the same time, siya ang communication. Sir, yung po sir, nagbumisita rin po ako kanina sa Quezon City. And maganda po yung tinatawag nating synergy of all sectors. First time po talaga na nakita natin na yung sumasama po rito ang national government, yung local government, yung private sector, yung Unilab po, yung medical sector. And then kasama rin po dito yung religious sector, yung Caritas, at saka yung diocese ng Novaliches. And then yung academe, yung FEU, NRMC. Nakita po natin na sama-sama po. Yun po ang kagandahan sa Quezon City, talagang yung diocese po ng mga yung mga bishop, tumutulong po kay mayor. And then kung makita po natin, yung mga mismong yung mga religious, sila po ang naghihikayat sa mga mamahirap na magpabakuna. Sa ngayon po, parang nakita po natin yung uptake po dito sa mga Islam area, tumaas po dahil kasi nakita natin malaki po ang influence ng mga ng mga medical professionals at the same time ng mga religious. So nakita po natin yung cooperation po nito kasi yung Unilab ganun din, nagkakaroon sila ng mga town hall meetings. At the same time, kasama po yung Caritas. Sir, for the information of the President, yung Caritas po, nung nakakahirap-hirap po tayo ng pag-ayuda, kasama po sila ng private sector na nagbigay po ng 7 billion ayuda. Talaga pong pumunta po sila sa mga mahihirap, nagbibigay po ng mga goods at yun po ay nakahingi po sila ng mga donations doon po sa mga conglomerates po natin. Yun po nakita po natin talaga na itong sa pandemya, even though there is a separation between the state and the the church. Sa pandemya po, sama-sama po tayo, Mr. President. Nakita natin na itong signing of cooperation, talagang tumutulong po ang ating mga kaparian dahil yung CBCP, inano na rin po namin. At karamihan po sa mga CBCP, mga seniors, nabakunahan na din po natin. At napapasalamat po sila, Mr. President. And then,
Go ahead.
next slide, please. Sir, ito yung yung parang presentation po sa amin ng Boston Consulting Group at saka ng mga expert na nakita po natin na yung tinatawag natin itong slide po nito, ipinakikita po namin sa business sector. Para po yung business sector at saka yung T3, kasi yung T3 po yan, mga conglomerates po yan, mahigit na 1,000 conglomerates. Binibigyan din po namin ng briefing kung ano po yung variant. So sa presentation po namin, kasama po namin si Father Nicolas Articio, kasama po yung mga expert ng Boston Consulting Group. Ito po, kung makikita po natin, Mr. President, this briefing, napakaano po eh. Kung makikita natin yung beta, ito po yung tinatawag na significantly worse. Yung beta po, ito po yung tinatawag na South African variant. And then kung makita natin yung delta, dalawa po ang pula dyan. Ibig sabihin, likely increase ang severity at saka yung kanyang transmissibility. Pero ang magandang balita po, sir, is at least yung yung mga bakuna po, pagka naka-double dose na po tayo, meron tayong protection. Ibig sabihin, baka bumaba po yung protection, pero at least nakikita po natin na pagka fully pagkaan po tayo doses, at least meron tayong added protection. Kaya po, yun po ang inano po natin sa ating mga kababayan, na talaga as much possible, yung mga ibang hindi pa nakaka-second dose, ay magpa-second dose na po kasi talagang once na hindi po talaga tayo nagkaroon ng second dose, hindi po tayo fully protected from the variant. So yun po ang inano ko lang po, mahal na President, na yung ating mga LGUs, kailangan magano po tayo talaga na hikayatin po natin ang ating mga kababayan na talagang kunin yung second dose. Kasi pagka first dose, wala po tayong talagang full protection po doon. Yun lang po, mahal na Presidente, at maraming po salamat.
Thank you, Secretary Galvez. We are through with Del. You have something to report?
Mr. President, I have nothing significant to report tonight, sir.
Okay. So tapos na tayo. Let's go to... But before we proceed any further, I would like to mention the medical experts, our resource person nandito who shared their time with us. Si Dr. Edsel Maurice Salvania, Dr. Cynthia Palmes Saloma, Dr. Eva Maria Coutinco de la Paz, Dr. Ana Ong, and Dr. Marisol Alejandria. Salamat sa panahon ninyo. I know that it's a little bit to be sacrificed to be here and to listen and to talk. Ang sunod kong gustong tawagin kasi binubugbog minsan ito ng criticism si Dr. Domingo. Dr. Domingo, it's your turn to blast them to pieces. Go
yes,
ahead.
sir. Magandang gabi po. Magandang gabi po, Mr. President, saka sa lahat po ng mga member cabinet kay Senator Go.
Alala mo, sa totoo
Yes,
lang.
sir. May konti lang po akong
Gawain mo lang yung trabaho mo. Do it right and to hell with the criticism. Demokrasya to eh. They are entitled to that right. So, ikaw naman, you have to take it in stride. Pareho ka rin ng politiko. Because we are performing public functions and our actuations are really being observed and other people maligaya. Maybe you cannot please them all. So you just do your duty and forget about we have trust in you, the Filipino people. Go ahead.
Yes, sir. Maraming salamat po. Yung lagi nyo namang sinasabi, just do my due diligence and rely on sound science for our decisions. At yun naman po ang sinusunod natin. Ano? At bigyan ko lang po kayo, sir, ng konting update sa ating mga vaccines na ginagamit sa Pilipinas at saka sa buong mundo. Can we have the slides, please? Wala.
Let me
Ayan
ask
po,
you.
ano. So sa ngayon po, Mr. President, yes, sir.
Let me ask you. Itong trials ba na ito, the vaccines made by several countries? How
Yes,
many
sir.
countries
Iba-iba pong country. Sa atin po, merong 4.
participating in this?
Yes, sir.
Okay, you have approved 18.
Sir, these are all over the world. There are now 18. May
Okay.
nadagdag po kasi this week na isang vaccine from Iran, and then before that there was one vaccine from Japan. Pero sa Pilipinas po, we have approved 8 vaccines po for emergency use authorization, and we have ongoing 3 clinical trials at may madadagdag po na isang clinical trial ng isang bago pong bakuna, at meron pa po tayong pending yung WHO Solidarity Trial for vaccines, and our vaccine expert panel, meron pa pong tinitingnan ngayon na 2 pa pong possible vaccine clinical trials. So maaari pong umabot ng mga 6 or 7 yung clinical trials po ng vaccines dito sa atin, sir.
Let me ask you, for purposes of just satisfying the issues surrounding itong Iver.
Ito lang po yung may konting updates ako, no? Yung kulay green po, yung Sputnik vaccine, ito po yung 2-dose vaccine na adenoviral vector na magkaiba. They've already written us to say that they might be amending the emergency use authorization para habaan po yung time interval between the 2 doses. Parang very similar po ito do sa adenoviral virus vaccine natin na AstraZeneca, no, which we now give to 12 weeks. So hinihintay lang po natin yung scientific data to support the claim na mas maganda pag pinapahabaan po yung time interval. And they're also thinking of registering the vaccine as a single-dose vaccine similar to the J&J, no, to the Janssen vaccine na single dose lang po ang binibigay. It is also an adenoviral vector vaccine. And we're waiting for the data to support this kung pong acceptable siya. Yung next slide naman po, may isa pa pong bakuna sa atin na may EUA, yung Bharat Biotech. This is an Indian vaccine which I think many of the LGUs are interested, no, in procuring through the tripartite agreement. Noon pong April, nabigyan na po natin ito ng conditional EUA, and now they have completed all of the requirements, including po yung certification nila ng good manufacturing practice. So there's no hindrance to them importing the vaccine into the Philippines, except of course that they have to go through, of course, the vaccine czar and the Department of Health. Kasi po under EUA po ito, hindi pa pwedeng i-market directly, no, sa mga consumers, kundi it always has to go through our vaccination program. And yun pong nasa pinakababaing sa Novavax, another promising vaccine, nagpadala na po sila ng preliminary data nila, and we're waiting na lang po for some for them to complete their requirements so that we can continue the evaluation. At konti lang, sir, information po on the variants, no, next slide. So since tandaan, if we remember, talaga pong ang mga vaccines na ginagamit natin ngayon were developed, of course, using the original COVID-19 virus. At unti-unti po nagkakaroon siya ng mga mutations, and in fact, ito po yung list, no, there are several mutations now. Started, of course, with the UK variant, nagkaroon po ng South Africa, Brazil, pati po dito sa atin, nagkaroon po ng isang variant. And the ones that is of concern now is the Delta variant. Next slide. Sa United Kingdom po kasi sa England, no, nagamit nila mostly Pfizer at saka AstraZeneca, and they did it quite early. At sila po ngayon yung merong medyo data, no, showing the effectiveness of the vaccines on both the UK variant and the Delta variant. And the results for so far the data for Pfizer shows that for the UK variant, yung Pfizer vaccine po mataas pa rin, nare-retain niya yung mataas na efficacy rate niya of 93%. Pagdating po doon sa Delta variant, although bumababa po ng konti, meron pa rin naman pong 88% na efficacy against the Delta variant. So there's a decreasing efficacy as we get more mutations, but hindi naman po completely nawawala ang bisa ng bakuna. It's still a useful vaccine. Yun naman pong AstraZeneca vaccine, ang nakita po nila na overall efficacy niya for the UK variant is about 66%, at nung tiningnan po for the Delta variant, it's about 60%. So nagagamit pa rin naman po talaga, may protection pa rin na ibibigay. Next slide.
Ganito
Unfortunately po,
muna.
sa mga...
Sandali lang. So, itong AstraZeneca, pati yung yung isa, they are...
Yun pong Pfizer.
Pfizer, effective, at least it gives you an ample protection against...
Well, sir, ngayon, sir, actually po ongoing din naman ang study ng mga itong bakuna like Janssen, Moderna, Sinovac, Sinopharm, and Sputnik on the efficacy nila against the Delta variant. Kaya lang wala pa po talagang nasusulat na report. No? But initial reports indicate that they are also useful. But of course, we expect that it will be a little lower than the original efficacy dun po sa original na variant po ng ating bakuna. So ibig po sabihin, lahat naman po ng bakunang ito, wala naman pong nawawalan completely ng bisa, even with the Delta variant. And kaya nga po gusto nating talagang igiit na unang-una, kailangan pigilin po natin ang pagpasok ng variant na to sa Pilipinas. Pero at the same time, since paunti-unti lang naman po ang nakapasok pa so far at controlled natin, in case meron pong makapasok, kailangan pa rin po talaga, we should all get vaccinated with the vaccines that are available now. Because this will still protect us and will help us stop the spread even if it comes in, ito pong ating Delta variant.
Well, given the shortage, because it does not come in trickles, but it is not really enough in numbers for comfort. Kagaya ng United States, madali sila because everybody had their vaccination. Itong atin, ginusto natin pero kulang. So yan lang ang sa atin is we can maybe do it as fast as any other country like America, but because of the limited supply, yan ang kaya nagdadasal na lang tayo na Secretary Galvez it's sometimes ang tawag nito, it's not desperation but it's exasperating. Whereas like kayo, si Charles, kung ano na lang ginawan para makakuha with so much effort and so much industry poured into the getting the vaccines. So, marami pang masabi. So ako naman, hindi ako sumasagot. Pero pag sumasagot ako, pinuputang ina ko talaga. Wala, ganun. So dito tayo sa panel, is there among the medical experts that I have mentioned, is there somebody who would want to give his or her opinion?
Mr. President, Dr. Salvania pa.
Wala na kayong sabihin. We will go to now to just a short Congressman Nograles, maybe a short message or report. The one that you have been
Yes.
giving us on a regular basis.
Yes, Mr. President. Magandang gabi po kay Senator Bongo at sa mga kasama natin sa gabinete. Mr. President, I'd like to report na under the leadership of your National Nutrition Council, the Philippines has become the first country in Southeast Asia and the Pacific to launch the Scaling Up Nutrition Movement 3.0 strategy. The launch was a success with almost 1,000 local and international nutrition stakeholders gathered on June 2, 2021 via Zoom and Facebook Live to witness the event. So this Scaling Up Nutrition 3.0 movement is committed to fundamental and non-negotiable aspects of effective nutrition action, including equity and the principle of leaving no one behind. So for its third phase, the SUN movement will drive forward gender equality and enshrine youth leadership across the movement. It will strengthen partnerships to achieve greater impact on nutrition through food systems, health systems, social preparation systems, actions by the private sector, and humanitarian and development actors, and through education and the water, sanitation, and hygiene or WASH and climate change adaptation. Together with that, your Nutrition Research Technical Working Group convened to discuss the plans for the development of a strategic plan for the Philippine Plan of Action for Nutrition Research Agenda. So this research agenda is actually a companion plan of our Philippine Plan of Action for Nutrition 2018 to 2022, which aims to provide evidence for the formulation of policies, selection and design of nutrition interventions, and the improvement of our nutrition program management towards the achievement of the Philippine Plan of Action for Nutrition goals and objectives. So we have meron tayong 9 priority transdisciplinary nutrition thematic areas that aim to guide the generation of research on nutrition in the country. On our part sa Task Force on Zero Hunger, tuloy-tuloy pa po yung aming mga webinar series. We've conducted 12 webinars so far, together with development partners, LGUs, academe, private sector, religious, civil society, non-government organizations, farmers groups, food technology adopters, cooperatives, and micro, small, and medium enterprises. Ginagawa natin, Mr. President, yung webinar series para to get more food technology adopters for our Department of Science and Technology Food Nutrition Research Institute, nutritious food products. We also did a webinar series to finalize yung national food policy po natin. And also yung pakikipag-usap sa mga local government units para sa ating Philippine Multi-Sectoral Nutrition Project. At yung pinaka-latest, yung pag-link up natin ng mga farmers groups, farmers cooperatives, and micro, small, and medium enterprises sa pag-access ng Deliver-E online platform para yung bentahan ng mga ani mula sa mga farmers papunta sa mga buyers ay pwede nang gawin na online, Mr. President. And finally, tinutulungan din po tayo ng DBM at ng DILG para sa kasama ng kanilang Dagyaw, which is actually part of their stakeholders meetings and advocacy campaigns. Itong Dagyaw Usapang Food Security at Nutrition, which was a virtual town hall meeting para mapag-usapan sa problema ng kagutuman at nutrition, on different issues pertaining to nutrition and how a food-secure nation can be the key to attain nutritional requirements for the country. Yan lang po muna, Mr. President. Thank you.
Thank you, Secretary Rurales. Now, maybe as wala na ba iba? Yes, Secretary Anyo.
Please put on my slide.
Si Salman yan.
Pakilagay yung slide.
Ang ganda ng sing-sing, oh.
Magandang gabi po, Mr. President, fellow public servants, workers in the government, Senator Bongo. Nais ko lang ibalita ang pagbaba ng bilang ng mga violations on mass gathering at mga hindi pagsusuot ng face mask mula ika-14 hanggang ika-20 araw ng Hunyo, habang tumaas naman ang naitarang bilang ng mga nahuling hindi sumusunod sa physical distancing. Sa kabuuan, 2,250 ang ating kinasuhan, magkasama sa not wearing face mask at no physical distancing. Next slide. Patungkol naman po sa mga nai-report na possible super spreader events mula noong buwan ng Mayo, minomonitor natin ang progreso ng investigasyon at mga kasong isinampa laban sa mga tao o opisyal ng barangay na sangkot sa mga super spreader events na ito. Mapapansin din natin na walang bagong kaso ng super spreader event ngayong linggo. Maituturing na magandang senyalis ito na marami ang tumatalima sa mga pahayag at utos ng ating Pangulo na paigtingin ang pagpapanatili ng kaayusan at bantayan ang pagsunod sa lahat ng health and safety protocols na pinapatupad ng pamahalang lokal at nasyonal. Pero atin pa rin pong titingnan yung mga reports ng mga nagbabiolate ng physical distancing, lalo na ang nagsasagawa ng mass gathering. Next slide. Narito naman po ang datos mula sa ating LGUs hinggil po sa bilang ng mga taong nabigyan ng bakuna sa kanilang area of responsibility. Nais natin bigyan ng komendasyon ng mga LGUs ng Quezon City na nakapagbakuna ng 414,850 sa first dose. Ang City of Manila na nakapagtala sa first dose ng 326,101. Ang Caloocan City naman sa first dose ay 238,768. At ang Parañaque City na nakapagtala ng second dose 79,111. Ito ang mga LGU sa National Capital Region. Outside naman po na NCR, andyan ang Baguio City na sa first dose ay 79,700 at 45. Samantalang ang nakapag-second dose naman ay 46,157. Sa Cebu City, ang first dose nila nakatala sa 55,214. Ang second dose naman ay 8,689. At sa Cagayan de Oro City, sa first dose nakapagtala ng 43,462. Ang second dose naman ay 16,850. Ito po ang pagsusumikap nilang mga pag-administer ng pinakamaraming first and second dose ng COVID vaccines sa kanilang mga nasasakupan. Sa ngayon ay 32,200,000 at 75,526 ang bilang ng ating mga kababayang nakapagparehistro ng kanilang intensyon magpabakuna sa kanilang LGUs ayon sa pinakahuling tala ng datos sa Vaccination Monitoring System ng DILG. Next slide. Dito naman po sa ating nakalap na report mula sa PNP at mapangsangay ng pamahalaan, nagtutulong-tulong upang mapuksa ang pagkalat ng ilegal na droga sa bansa. Nakita po natin 12 ang nag-surrender. Kabuang operasyon po kontra sa droga, 1,128. At ang naaresto naman ay 1,547. At sa operasyon ating ginawa, 10 ang napatay dito sa operasyon na ito. Kasama po ang isang very notorious drug lord, si Montasir Sabal. Ito po ay isang dating mayor ng Talitay, Maguindanao at sinasabing kasama po o sangkot sa Davao City bombing noong 2016 nung binomba ang night market. Siya din ay isa sa nagsusupply ng armaments at explosive sa BIFF. At doon po sa follow-up operation ay naka-recover tayo ng 3 armas kasama ang isang 50 caliber machine gun. Sa kabuuan po na operasyon natin ginawa, ang lahat ng ahensyang aking nabanggit ay nakasamsam ng pinagsamang sabot marijuana na may street value na 121 milyon, 151,000 at 138 piso. Bilang panghuli, nais ko lang banggitin ang paalala na ang bakuna ang pinamabisang panlaban sa COVID-19. Kaya hinihikayat ko ang lahat ng Pilipinong magparehistro sa pinakamalapit na tanggapan ng lokal na pamahalaan. Muli po kami nakikiusap na huwag tayo basta-bastang maniniwala sa kung ano-anong impormasyong nababasa sa internet o sa social media at lagi natin kilatisin ang kredibilidad ng anumang impormasyon lalo na kung tungkol ito sa kalusugan at kaligtasan. Panawagan naman natin sa ating mga LGUs, hanapan po natin ang paraan at pag-isipan natin ang iba't ibang estratehiya upang mas marami pa ang maengganyo magpabakuna at upang matulungan din natin ang ating mga kababayang walang access sa computer or internet na makapagparehistro. Yan lamang po, mahal na Pangulo. Maraming salamat po.
Salamat, Secretary Anyo. Alam mo, itong, if you would notice, I don't know, pinapublish pa lahat mo yung mga taong na-aresto araw-araw? Almost about, we're, on the average, we are arresting all throughout the Philippines something like almost, on the average, 800 a day bago itong mga sampa sa droga. And every day, we are able to seize shabu, including itong mga nag-i-import, because there is no laboratory now. It's imported from a country outside of the Philippines. Ito yung hindi nakikita ng, kaya ako galit dyan sa ICC na yan. Biro mo, almost 700, 800 people all over the Philippines are arrested. Different people. Hindi yan sabihin mo na recalcitrant na pabalik-balik. And you just can imagine, almost every day you look at sa 8888 yung sa TV, kita mo yung mga pangalan dyan, minsan umaabot ng 1,000. Oh, how do you, if you do not move against them, it will destroy our country. Ito narco-politics to. There are mayors, yung iba patay na, I'm sorry, mga ilang mayors, almost last year, mga mayors na namatay, mga the other year, on the average, kasi pumapasok sila sa droga. Now, we are not saying that we are killing them. We kill them because they fight back. Ganun talaga ang, if you go to the history ng itong Mexico. Mexico is almost a failed state. Ito yung sinalosa ang they select the people who run for local government posts. Kaya pag magpatuloy ito, saan tayo pupunta? Paano ang bayan kung ito kung gano'n? Na ako na mismo, napaka-stricto ko. Eh sabi sa kanila, pinapatay ko. Ewan ko lang kung totoo yan o hindi, chismis lang naman yan. Pero, paano ito? Kahit itong ICC, bullshit itong, I will not, why would I defend or face an accusation before white people? You must be crazy. Yung mga kalumang colonizers ito noon, they have not atoned for their sins against the countries that they invaded, including the Philippines. Tapos ito ngayon sila, they're trying to set up a court outside our country and making us liable to face them. Walang alaw ng batas, our laws are different. criminal procedure is very different. How are you supposed to get justice there? Kaya ako nag-withdraw. And beside, I said, the one thing that ang depensa ko is yung Rome Statute na ratify sa Congress. But itong mga unggoy na to, dahil nga in their desire to itong extrajudicial killing, dumiretso doon sa Rome and appended the treaty that was approved by Congress. But the law says that after Congress, you have to return the treaty to the President because the President now will order the Bureau of Printing to publish the statute or law, lalo na penal laws. You have to publish it in the official gazette, and that would put on notice, constructive notice, to all the people na masabi, there is a law. That is why kung not published na yan, you cannot say, ignorance of the law excuses no one. Ganon yan. Hindi nga dumaan ng hindi na binanyak nila ka Estrada diniretso na kaagad. In their hurry, they forgot. So, how are you supposed to know about this goddamn laws o itong mga batas nila itong sa ICC? Yung mga ulol. Tapos ako magharap ng mga puti, let's say kayo. Gano'n nyo akong I will readily face a court being accused in a Philippine court before a Filipino judge. Huwag nila akong lalo na yung prosecutor yung I do not want to insult. Kaya itong droga nga, kita mo, every report ni Secretary Anyo, did you not notice, puro droga ang anak ng waiting, and the seizures of drugs are aplenty. So paano itong ating bayan, gano'n na lang, tapos yung mga mayor, mga barangay captains, mga pasok, kasi madali ang pera Kaya karamihan sa inyo, namamatay ang mga putang ina ninyo kasi sinabi na huwag Di ba sinabi ko sa inyo, do not destroy my country because I will really kill you. Do not destroy the youth of our land because I will kill you. Period. Wala na tayong dyan. And I will repeat that before kung gusto nila marinig sa tribunal. That is kasi itong droga matagal na ito. Maraming mayor na namamatay na. And yet, it goes on and on every day. Transactions there. And we are able to seize in bulk. Minsan, maabot ng bilyon ang kaya gusto sampalin ko yung mga judges niya. Loko-loko pala kayo You want my country to go down the drain. Justice, prosecutor ako. Of course, I can defend myself. Wala akong sinabi na you kill Mr. Santos Alex. Never said that. But I said I will kill you if you destroy my country. Yan ang sinabi ko, yan ang totoo. On that I concede na sinabi ko talaga. At sabihin ko yan. Now, maybe as a closing remark dito si Secretary Panelo has been going around the country. I don't know what's the feedback. How do you assess pasal yung ng tao? Dito muna sa bakuna. Yung mga yawa na ayaw magpabakuna.
Magandang gabi po, Ginoong Pangulo at mga kasama natin sa Senado, kay Senator Christopher Lawrence Bongo. Yung pong pag-ikot ko, initially, yung mga unang buwan ng pandemya, talagang marami pong ayaw magpabakuna. Pero habang tumatagal, kakapakinig sa paliwanag ng mga doktor, mga scientists po natin, ang panawagan ninyo, panawagan po ng mga secretaries natin, unti-unti naman pong bumaba ang bilang. Katunayan, kung matatandaan po ninyo, yung survey ng Pulse, 74% ang ayaw pong magpabakuna. Pero ang pinaka-latest ngayon ay 49%. So ibig po sabihin talagang marami na ang gusto magpapabakuna. Lalong-lalo na nga nung nakita po nila yung mga leader nila sa kanilang probinsya na nagpabakuna. At lalo na nung kayo nakita na nagpabakuna na rin. So ibig sabihin, talagang kailangan ng bakuna at yan lang magiging daan upang makabalik po tayo sa normal. Upang bumalik sa kalusugan ng ating pangkalakalan o ekonomiya. Ang mga hinaing lang po ng mga probinsya, like halimbawa sa Batangas, sa Nasugbu, sa Mindoro, at kahit na rito sa Maynila, nanggaling tayo dyan sa Tondo, sa Payata, sa Holy Spirit, marami pa rin ang hindi na babakunahan sa kanila. At humihingi sila ng, nakikiusap sila kung maaari naman, bigyan na sila. At sapagkat naririnig na nga nila na marami na tayo na darating na mga bakuna. Kaya yun ang pakiusap nila. Pagdating naman doon sa mga madali ang pangangailangan nila, halimbawa yung mga informal settlers, siyempre humihingi rin po sila ng tulong sa Pangulo at sa pamahalaan na kung maaari naman, doon sa tinitira nila ngayon, sa ilalim ng tulay, sa malapit sa estero, sa mga pribadong lupain na hindi naman kanila, at napagsusunog pa, hindi mo malaman kung talagang sinadyang sinunog o na-aksidenteng nasunog. But ang katotohanan, talagang wala ko silang bahay, walang matatawag na sariling bubong na hindi na nila iisipin kung sila'y mauulanan o mababa o ano. Pero ito naman nung ating mga department secretaries, pag tinatawagan naman po natin, ora mismo naman, meron kagad na mga kasagutan. Halimbawa si GM Escalada, nung nagbigay po kayo ng direktiba na bigyan ng mga housing units, meron kagad na bigyan siya dyan sa Holy Spirit, mga 50 na. At marami pang humihingi. At sinasabi naman po ni James Calada, marami pa naman tayong units dyan sa Santa Rosa, dyan sa Rizal, at sa Cavite. So natutuwa po sila, lalong-lalo na nung kayo nag-video call at kinausap niyo sila. Doon naman po yung sa mga, at siya nga pala, sabi ko nila, mukhang dito lang sa administrasyon na nangako at ibinigay at immediately. Kasi ilang araw lang inasikaso na yung mga walang bahay at palagay ko ilang araw na lang ibibigay na sa kanila yung mga housing units. Kaugnay naman po dun sa mga problema ng mga mangingisda. Ang huli kong kausap ng mga mangingisda sa Mindoro, mukha naman lumuluwag na ng konti. Hindi gaya nung nireklamo sa atin noon na wala ka lang lisensya, iuhulihin ka na, pati ikukulong ka na, pati yung mga boat nila kinukumpis ka pa. Sa iba naman pong parte ng mga barangay kapitan, ang hinihingi lang mo talaga nila sa ngayon, kung maaari lang, maliban pa doon sa dagdagan yung kanilang mga allowances, hinahanap po talaga nila yung, kasi nasa front line sila Gusto talaga nila yung bakuna kung maaaring mauna po sila. Bigyan na sila ng bakuna. Yan ang kanilang hinihiling. Yan ang mahigpit talagang tagubili kung maaaring iparating natin sa inyo. Now, Ginoong Pangulo, gusto ko po sanang ibahagi sa inyo ang aking kaisipan, kaugnay naman dito sa nangyayari sa Cebu. Sapagkat nakausap po natin si Governor Glenn Garcia nung isang araw at saka kanina lang habang nag-meeting tayo nagkausap po kami. Unang-una ibig niya iparating po sa inyo na wala siyang kinalaman doon sa tiyago na final ng dalawang abogado at hindi siya sangayon doon. Pangalawa, noon niya pa sinasabi na hindi naman siya lumalabag sa protocol na ibinaba ng IATF at nilagdaan niya naman at inaprubahan. At nagpaliwanag po siya ng mga kadahilanan kung bakit naman ang pinatupad nila ay yung ordinansa. Unang-una, sabi niya, I quoted naman, I have an ordinance. Baka naman ako ang mademanda rito pag hindi ko ipasunod. Kasi yung ordinance nila doon, iba sa protocol na ibinaba ng national government. Sa kanila, 3 araw lamang, may swab na, tapos ika-quarantine sa bahay. Sa atin naman, 10 araw. Medyo binababa sa 7, pero naibalik ko lang sa 10. Sa tingin ko po, Ginoong Pangulo, yung pong ginawa ni Governor Gwen Garcia ay hindi po maaring sabing talagang intentional na paglabag. Sa tingin ko, unang-una, hindi niya nga malaman kung yung bang ordinansa, ano ba yun, susundin ko, hindi ako ba madidemanda rito, hindi. Pangalawa, palagay ko mas malakas po yung naririnig ko na paliwanag mismo ng mga OFWs at saka siya, na sila po mismo ang nag-aapila kay Governor Gwen Garcia na pati na yung mga returning residents. Kasi nga, by imposing yung pong 10 araw, nagre-reklamo yung returning residents kasi, sabi nila, magbabayad kami ng hotel ng 10 araw. Kamahal-mahal ng hotel. Can you imagine kung 4,000 yun ng isang araw, i-multiply mo by 10 yun. So, wala nang ang pera dahil nga sa pandemya, nadagdagan pa. Pangalawa, yun naman ang mga OFWs, ang complain naman nila, o ang sama ng loob nila, ay kaya ho sila umuwi galing sa Middle East o kung saan mang galing sila nagtatrabaho. Dahil meron ho sila mga personal na dapat na asikasuhin, emergency, may bibisitahin, may sakit, na membro ng pamilya, o may namatay, o kung ano pang mga mahalagang bagay na dapat nilang asikasuhin. At ang paalam nila, at binibigay lang na bakasyon, mahaba na yung 10 araw. O can you imagine, kung 10 araw nga naman, nandun ka sa quarantine, natapos na, babalik ka na. So, parang walang halaga yung pagpunta nila. At, siyempre, parang ang sama-sama ng loob nila, bakit parang pinarurusahan sila. Pero pinaliliwanagan naman natin nga na talagang unang-una yung ordinansa, kahit ang sinabi nyo kanina, cannot prevail over the national policy. Pangalawa, yung patakaran na yan, hindi naman para mayamot sila, mabuisit sila, o sila'y gawin nating maiinis, o kaya discomfort sa kanila. Kung hindi, yun naman talaga batay sa siyensya at nagbibigay ng protection sa kanila. Yun ang mahalaga ho doon. Kaya sinasabi mo naman ni Governor Gwen Garcia, kaya nga daw inanyayahan naman sila Dr. Duque kasi yun ang mga doktor din, iba rin kasi ang pananaw. Parang meron din silang mga trials doon na lumalabas na okay naman daw yung pinatutupad nila. Kaya yun ang mga suliranin. Pero ibig niya hong ipahiwatig sa inyo na talagang I'm not defying the national policy laid down by the national government.
Yes,
Talagang tumutugol lang ako sa apila nitong mga OFWs sa mga returning residents. Plus, at the same time, merong ordinansa. Siguro hindi siya na palagang mabuti ng kanyang mga abogado at hindi niya rin alam kung paano diskarte. Siguro naman, dahil na nga nagkakaroon ng
I understand the plight of Governor Garcia. Pero kasi ito, probably what happened was he was guided by the ordinance. But itong pandemic kasi, it's a national emergency. And the whatever executive order or whatever is recommended and approved by me remains to be obeyed. Ngayon, I cannot make an exception doon para sa Cebu. Kung sabihin talaga nila ng ang task force that you have to go into a quarantine for 10 days, hanggang hindi nagbago yan, wala tayong magawa. And para sa akin, I understand that they are really eager to go home. Once the plane lands dito sa Pilipinas, ang ano nila is really to go home directly. But the problem is, there are rules now to be followed because of the pandemic, the crisis. So we have to, alam mo, they have to subjugate them, their desires, ano man yan, to the national interest of the country. So, all that she has to do is to explain to the DILG. The DILG naman ang may jurisdiction yan eh. Hindi naman ang task force, hindi naman tayo. If you do not want to follow, then the DILG would call your attention. Parang ganun lang yan. Pero I understand the sentiment of most of the returning OFWs, and that is really they're itching to be back home. I understand that. It would be something like of a purgatory, going home, then finding yourself being sequestered for 10 days. Ito na lang. You know, Congress appropriated so much money for bayanihan. I think that if there is may residual pa dyan na iwan, it behoves upon the government to pay for the sequestration expenses of the every returning Filipino. Kaya nga binigyan natin ng malaking pera ng Congress, and I think this is still, basa ko sa newspaper ngayon that 10 billion basta billion remains not utilized. So yung pera na yan, I said, dapat yan para sa mga returnees na umuwi, na wala na nga pera. Kung may pera man, para mga regalo sa mga anak mo. So, I am ordering now, everybody, including the government units, hotel nila o babayaran ng national government yan. As to when there is money, and we will do it as fast as we can. Maybe the DSWD would take care of that, or the DILG, para mabayaran. I will order to hasten para mawala yung dynamics about the expenses of keeping them in sequestration. Yun lang ano ko. Ang partida ko sa iyo is bayaran ng gobyerno. Tell Gwen that sabihin lang niya at yung mga hotel, mga motel, whatever, it would not entail any delay. I will see to it that it is implemented immediately, especially in the matter of the payment of the expenses of sequestration. Yan lang. Kung wala naman siguro, I'd like to thank our guests. Ma'am, maraming salamat sa inyo. Please accept our gratitude for helping us. And nandito, we have to still another Talk to the People program. Ito yung kausapin ko yung mga tao. But still, it would revolve around itong itong gago na ayaw magpabakuna, and they are really the carriers. If you are, they can, travel from one place to another, carrying the virus and then contaminating other people. Ito yung ayaw mapagbakuna. Kaya kung ayaw pabakuna, babakuna ko yung sa bakuna ng baboy. Yung ivermectin. Yun ang ibakuna ko sa kanila. Tigas ng ulo eh. Kaya pag don't get me wrong. There is a crisis being faced in this country. There is a national emergency. Kung ayaw mo magpabakuna, ipa-aresto kita. At ang bakuna galing tusok ko sa puwit mo, putang. Visit kayo. Hirap na nga tayo, tapos nandiyan pa kayo pagkaraming So, lahat ng Pilipino nakikinig kayong bantay kayo. Don't force my hand into it. Kagaya nitong strong arm method yan eh. Walang may gusto niyan. Pero kung hindi kayo magpabakuna, umalis kayo sa Pilipinas. Go to India if you want, to somewhere, to America. But for as long as you are here and you are a human being and can carry the virus, magpabakuna ka. Otherwise, I will order all the barangay captains to have a tally of the people who refuse to be vaccinated. Kasi pag hindi, yung ivermectin na para sa baboy ang patira ko sa iyo, ayun, patay talaga. Pati ikaw. I said, I'm just exasperated by Filipinos not heeding the government. Total tayo dito, wala naman tayong hangarin kundi kabutihan ng ating bayan. So that 40%, hanapin ninyo yan. Kayo mga barangay captains, I'll task the DILG to do that. To look for these persons, and kung hindi, I will order their arrest. Sa totoo lang. Why? Because if you are a person na hindi ka vaccinated, you are a carrier of a potential carrier. And to protect the people, I have to sequester you in jail. Mamili kayo. Magpabakuna kayo o ipakulong ko kayo sa silda. Sabi ko sa inyo, yung silda dyan sa mga pulis, walang linis yan. Tamad yung pulis maglinis. Nandoon ng lahat na ng baho nandoon. Doon kayo. Ganito na lang. I will think it over very hard. Legally, of course. Pero pag hindi ayaw ninyo, ipa-aresto ko kayo. That is in pursuance to a policy of our crisis of itong health issue. So, once again, I'd like to thank everybody, and I suppose that this will end our talk now. I hope that I can be honored with your presence next time we need it. Maraming salamat po.